Okay, good afternoon, everyone. My name is Dr. Teresa Northington, and I'm the Developmental Screening Coordinator for the Bureau of Family Health. And it is my pleasure to welcome you all to our last webinar session that was a part of the Developmental Screening Summer Webinar Series. And today we have the pleasure of having Dr. Chantel Herbert-McGee join us today from Louisiana Medicaid to share with us some wonderful information and updates around the Medicaid Unwind and policies, reimbursement, and just all the great things we want to know. So just a quick little background for Dr. McGee. She is the Chief Medical Officer with Medicaid at Louisiana Department of Health. Previously, she was the Region 1 Medical Director in the Greater New Orleans area and the Clinical Laboratory Improvement Amendments Laboratory Director of the Louisiana Office of Public Health. Prior to her state tenure, she has functioned in healthcare as a clinician, industry consultant, minority health strategist, and nonprofit CEO. She has authored more than 70 peer-reviewed publications, editorials, white papers, and book chapters, and she is a native of New Orleans. Dr. Herbert-McGee completed her undergraduate studies at Clark Atlanta University, and she earned a medical degree from Georgetown University School of Medicine and a master's in public health and health policy and management from the Harvard T.H. Chan School of Public Health. So we are so welcome. We are so grateful to have you, and I'm going to give it over to Dr. McGee.
Thank you. Good afternoon, everyone. So I have one of the most commonly mispronounced names. So it's Herbert-McGee. It is a Louisiana name. And so, and I believe Herbert is the most commonly mispronounced Cajun Creole word. But so for everyone listening, I'm happy to have you and happy to give you some updates when it comes to Medicaid, where we are. And I think the big subject is Medicaid Unwind. I'm sure many of you have been inundated with information, but hopefully I can provide a framework to how we got to this point and what we need to ensure that we are covering services, particularly for our pregnant women and children. So okay, so in regards to where we are currently, I'll try to divide this talk into three parts and spend very few, just one or two slides on the latter two aspects of this slide deck. I would say that if we're going to talk about Medicaid coverage, just for background, Medicaid is a program that allows for the federal government and the state to have a joint effort. There is a match to provide insurance to those who are low income, primarily pregnant women and children. Originally started in 1965 as part of the Social Security amendments. It was meant to offer coverage to those who had been part of minoritized communities. We know that over 60% of Americans receive their healthcare insurance through their employers, and oftentimes certain segments of our population were alienated from these opportunities. They were not permitted to unionize, therefore they could not demand healthcare insurance. And we saw during the public health emergency that primarily Black and Brown folks were individuals who were having some of the most disparate outcomes, as well as increased incidence of COVID-19. And in part, the demand for insurance increased during that period, because even until this day, a lot of people who work in hospitality and domestic services are not covered. So that just sort of gives the landscape to where we were. A part of that also is the Affordable Care Act. We know that in 2010, the Affordable Care Act allowed for people to get coverage through Medicaid up to 138% of the federal poverty level. Most states prior to then, for kids 1 to 5, it covered 133% of the federal poverty level. In kids 6 to 10, it was 100% of the federal poverty level. So therefore, it allowed for more families to be eligible for healthcare coverage and to interface with the healthcare system outside of the emergency room and uncompensated care cost. So as of June 2023, we have over 2 million Louisiana residents who receive some type of Medicaid benefit, and that's roughly 44% of the population. And speaking to the historical narrative as well as the expansion during, afforded by the Affordable Care Act, and then of course we had the Families First Coronavirus Response Act, which took place in 2020, allowing for preventing states from removing individuals from Medicaid. So we were not allowed to disenroll because we were in the midst of the public health emergency. However, the Consolidated Appropriations Act signed in December of 2023 allowed for Medicaid to be decoupled from the public health emergency, and thus in the spring, most states began the disenrollment process. So our numbers are slightly higher than what they would have been, in part for people seeking insurance during the public health emergency. The lack of the, it was improper to remove people during the midst of the public health emergency. So we are expecting for people who are truly no longer qualifying for Medicaid based upon our current fee structure, as well as those who do qualify, but have yet to complete their re-enrollment. And I'll speak to that more in the future. So of the 44% of Louisiana's population that is covered by Medicaid, 45% are children. And I think that's akin to most states. And if we were to look at just the Medicaid population itself, children account for nearly 54% of Medicaid beneficiaries. Now, when we talk about, where are our beneficiaries located, I would say that they're located throughout the state. So I think this would impact every provider who's listening and people who interface with our delivery systems of care in the state. We can see there is some variance, and particularly in the northeast part of the state, we do have a higher percentage of individuals who receive Medicaid benefits. I would say this in part, due to the historical narrative, including limited economic opportunities, as well as lower education attainment. And these two factors not only impact the health of an individual, their health literacy, and just their overall wellness. So recognizing that we do have health professional shortage areas, which sometimes coincide with areas where people are more impoverished, it makes trying to address these issues a little bit more acute. And I think awareness is the first step. So for providers to recognize that there are differences in access to care, as well as the economic stability of different households, will help to be able to shape how individuals tailor their practices and inform their members and their patients about what's going on with Unwind, and to try to encourage them to ensure that they are participating in the re-enrollment process if they have received notification that they must participate. So there are currently 6 health plans serving Louisiana, and 2 dental plans, as well as that accounts for roughly 90% of our Medicaid beneficiaries. There's approximately 10% that receive their benefits through fee-for-service, and that's primarily those who have long-term care, and a very small cohort or subset of pregnant women. So it is not unusual for people to go through the renewal process. I think that there has been a lot of angst, and for some, there's been a frenetic response because it's like, oh, people are being disenrolled. As mentioned before, this is something that happens routinely. We look to see if a person still qualifies. We look at the monthly average gross income, as well as other eligibility criteria that would determine if a person should continue to receive their health care insurance through Medicaid. Obviously, some people can qualify for the marketplace, or they may now have an employer or be able to pay for insurance out of pocket. So, the goal is not only to assist with the renewal process, but also refer people to proper channels if they no longer qualify for Medicaid to ensure that they don't have a lapse of coverage. Now, I mentioned before with the, we're doing this, and we started doing this again since the Consolidated Appropriations Act in December. And so that has allowed for us to commence the review of applications and looking at the income and other criteria for our Medicaid beneficiaries in April of this year. So our renewal process will be staggered across 12 months. There are some states that have chosen to do an expedited process. We wanted to assure that we were giving our members adequate time. We wanted to ensure that we had the workforce that had the bandwidth to be able to do this task properly. And so we were very intentional about the 12-month period. It requires robust services. It requires a lot of communication, to promote and to advertise and let people know. And also the redetermination process can also sometimes be lengthy, depending on if the person is able to readily present the information that is required in order for us to be able to make the most appropriate decision regarding should they continue to receive benefits through Medicaid. The good thing is that approximately half of our renewals are they're part of the ex parte or streamline, meaning that there are other mechanisms in which we're able to validate or confirm that the member is eligible for Medicaid. So whether that's SNAP, WIC, other benefits to determine if the family, the child, the adult is able to qualify. So that means that, just the other half would have to go through the re-enrollment process. And so it is required by the federal government that we have two methods to try to reach out to members. And one mandated is paper mailing. And so, that has several obstacles. The reality is that most people do not check their mail routinely. I think that our mail service has become somewhat archaic, and because we have other mechanisms to communicate, which leads to a more expedited communication. So whether it's through text or emails, phone calls. And so for most people, mail oftentimes just collects a lot of junk mail and coupons, and so they don't readily check the mail. Additionally, we know the members that we serve through our Medicaid program, most of them are not homeowners. And so there is a tendency, because of their economic bracket, for them to move. We know that affordable housing is a crisis nationally as well as in the state of Louisiana. So those members may move, and so they may not receive the parcel asking for them to complete the letter and send it back in or fax it in. And so we are trying to be very comprehensive in our approach and how we communicate. And so aside from mailings, we're using a plethora of other communication tools in order to ensure that we are making a concerted effort to reach out to members. And so, as mentioned, it does, they'll receive a letter. This is the sample letters, the highlighted important information is in bold. So we know that sometimes people may just skim something, and we want to ensure that they see what's most important. And so, and we try to make it simple for the members as well. So we auto-populate information. So therefore, it's not a heavy lift for them to complete this information. However, it is the responsibility of the member or their authority, guardian, to ensure that that information is correct. So, as mentioned, we are using a myriad of ways for communication. For those who are more tech savvy and have the bandwidth, whether it's internet access, then they can do it online. We do know that a significant subset of our membership are older Americans who prefer to still use paper and pen and put a stamp on it and go to a post office. I would say a mailbox, but I don't even think we have those on the street anymore. So they are willing to go to a post office, and it gives them purpose, right? So my grandmother, she loved going to the post office. It was like her thing that she did every week. So, and for others, they can use email or fax. They can come in person. We do know that sometimes there are literacy issues, and we want to make sure that we are thinking about how are we communicating with our members and allowing for them to also be able to have some autonomy, even though there may be differences in their ability to communicate. And of course, they can call over the phone as well to complete this process. So I think that there's a lot of confusion because people hear these different numbers, and so one day is when they'll receive notification, and then 30 to 45 days later they receive a second letter that pretty much states that we have not received a response from you. And then after roughly a 60-day period, they will be disenrolled. However, as mentioned, we know that people are unhoused. Their mailing address may not be their physical address. They may not check that post office box or their mailbox routinely, particularly if they live in areas that are remote, or they feel that it's not safe to have their mail sent to their dwelling. So we know that there may be a lag in the receipt. So trying to accommodate for that, as well as other extenuating circumstances, there is an appeals process. So while this is the initial closure, members can connect to Medicaid again in order to reactivate their account and their benefits. So there is a 90-day window in which members are allowed to come back and say, hey, for whatever reason, I have not been able to complete the re-enrollment, whether they had issues with their phone, they didn't have phone service, they didn't have data, so a myriad of issues that we know impact our members. And so being sensitive to their needs, we do have a 90-day window in which they are able to reach out to Medicaid for renewal. They can also ask for assistance, and the coverage is retroactive for those who are determined eligible within that 90-day window. So when it comes to claims, particularly if there are providers on this call, do know that while they may show up and not be active, and you're able to see them, that you can be compensated for providing those services during that 90-day window if they are determined to be eligible. So in addition to those various mechanisms that I just shared of how we are attempting to communicate with members, and members have been responsive. We've sent out a flurry of text messages to the first set, roughly 165,000 people, and readily we can see who opened the message, and then people said, they unsubscribed. So some people, they did complete and initiate their application after receiving that ping. Others say do not ping again. So we know that people are receiving these various communications. And as mentioned, we know that some people no longer are eligible. And instead of notifying us, they're just trying to bow down or bow out, I guess, discreetly. And so for some, they are, we have referred them to the marketplace when they do not qualify, but they did attempt to do re-enrollment. So I think we have been very intentional, as mentioned before. In addition to that, in addition to taking advantage of the full 12 months, we've launched, very robust efforts through radio, television, billboard, social media. I think if you have stepped outside of your house or have connected to your electronic devices, you have probably seen one of our advertisements. We try to ensure that the language was easy to understand. Some of them are more pictorial. Some of them have, a lot more written language. So, recognizing that people respond to different type of advertisements. So we really wanted to, try to make sure that our message gravitated to our audience in the manner that would be receptive to them. And a part of that, we know that, there are some people, when you look at response, there are early adopters, people who immediately, as soon as they receive a letter or communication, they tackle it. And then we know there are those who are somewhere in the middle, and then there are laggers. And for those who, for whatever reason, have not been very receptive, we know that sometimes it takes a little bit more hands-on, eye-to-eye, face-to-face contact. And for that reason, we have contracted with several community-based organizations to conduct door-to-door outreach utilizing the mailing address that we have. Unfortunately, if that address is not up to date, right, there's a potential that we may knock on a door, and that is not the intended person that we would hope to have a conversation with and assist them in completing their re-enrollment. But that information is communicated, and then we try to see if we have another address for that person, so we can continue those efforts if they have not responded during that interval between speaking with the community-based organization and and someone from the Medicaid office. I would say our CBOs and partners have been very creative. They have gone to different events tailored to various communities and demographics. They've gone to graduations. And particularly when it comes to kids, we recognize that for many parents, or there'll be an opportunity to engage before the school year starts. So right now is, the perfect time for many, parents and children to update their re-enrollment. We know vaccinations and other requirements for school, and it may require them to see a practitioner. So it's a perfect opportunity to have that reminder. And, if you don't feel comfortable having a conversation, there's plenty of literature that we have, and I'll share that with you later on this presentation that speaks to this. And, and it allows to be able to discreetly or to overtly have that conversation to ensure that that member has coverage, and that the kid can start the school year hopefully with optimal health. And so these are some of the different types of advertising that we have. As I mentioned, some have a lot of written information, some it just leads you to the website, and some, has more of a cartoon message. And so while it may not directly speak to it, it puts it on the back of your mind in the recesses and say, hey, I have to take care of this. And so we're hopeful that the funding and resources that have been invested will prevent the churn and for individuals showing up to facilities uninsured. And so we don't have uncompensated care if this can be avoided. Ways you can help your patients. Obviously, you can refer them to the toolkit online. You can download some of this information and print it, set it up in your offices, in your facilities, and patient rooms. If you go to edifices of praise and worship, you can get up and say, hey, I want to remind family members to ensure that your kids are prepared for school. And if insurance is an issue, please, go to Medicaid and see if you qualify. I think one of the things is that people they conflate and they think that Medicaid Unwind is somehow associated with the Affordable Care Act and that we are changing the qualifications. I think people also have the misunderstanding that if they don't qualify based upon the 138% of the federal poverty level, that they cannot receive Medicaid benefits. For kids who have, significant, disease states or conditions that warrant medical intervention, and even if the parents or family does make an income that exceeds the 130% of the federal poverty level, they may still qualify given the medical expenditures associated with that condition or disease state. So I think it's important to also share that with members with your patient base, because they may not think that they qualify. And so they may have Medicaid in addition to whatever commercial insurance they may currently have. So I think, feel comfortable in broaching the subject. And if not, you can use these various different communiques in order to, and maybe having it in the room beforehand will allow for the patient or member to ask questions. And that could also help to stimulate the conversation. Additionally, we recognize that we do have great diversity in the state of Louisiana, and so we have materials that are available in various different languages to accommodate different patients and demographics. Remind them to check their mail. Sometimes say, I didn't receive it in the mail. Someone picks up the mail, they put it in the bread box or something that no one checks. So just remind them to check their mail. They can also log on to Medicaid.com, mymedicaid.com, and check their account and see what their status is. And then they can send emails, right? If they have questions regarding the status of their application, has it been processed, has it been received? We know that there is a lag sometimes in mail, and because it is going to a government entity, there are several stops before it gets to the Medicaid, enrollment area. And so from that stance, it may be a little protracted. So it's fine to communicate and ask what's the status. We actually appreciate knowing that it is en route, and so it helps to give us perspective. And so we love to engage with our members. So I'm showing this slide here. This is from the Kellogg Family Foundation. And so what they, and this is from a study or a report that they issued, talking about who's going to be impacted by Medicaid Unwind. And so, as I mentioned early on, that during the public health emergency, we saw influx of people for various reasons. Some of them, it was their first time interfacing with the healthcare system because they contracted COVID or they became sick during that period. And for others, whether we know nationally, many people lost their job and so they qualified. And the majority of people who received coverage during that period were adults that would be part of the expansion population, as well as children under the age of 19. And so as we look at who is going to be impacted, we do expect to see a loss of adults as they now move into other healthcare plans. But we also expect to see children. And we want to ensure that those children do have coverage. And so, please speak with the parents and assure them that, they should still complete the re-enrollment process, even if they think that they may not fall within the monthly average gross income. We have several different criteria for Medicaid eligibility and different subgroups and types of Medicaid. And so while they may not qualify for one, they may qualify for coverage under one of our other eligibility criteria and then be moved to that group and still receive their benefits. So we don't want them to have a very myopic view and think this is the only, it's a zero sum. There is the possibility that they can get coverage through one of our other enrollment groups. And so, through Act 421, the Children's Medicaid option, we know that, this program disregards family income and covers the needs of children that have disabilities. And that's what I was speaking to earlier for kids who have certain conditions or disease states. And so roughly we have, well, not roughly, according to June 2023, we have 1,204 children who are covered through this program that would not otherwise qualify. And so, these members would still qualify if they completed the re-enrollment information. And so please make them abreast of this, and I don't want them to confuse or think that they are no longer can receive coverage because Medicaid has been delinked from the public health emergency. For members who have lost coverage, you may have people who show up and they did not realize that they lost coverage. And so you can reassure them that if it's within 90 days, that they can complete their packet. For some people who have case management in their offices because of certain disease states, you may be able to help them through your case management or patient help navigators to assist them in this process. And as mentioned, we will retroactively cover all claims during that period. For members who feel their closure was, happened prematurely or was in error, they can request a fair hearing. For those members after the 90-day period, if they are determined to be eligible, they will not automatically be placed back into the same healthcare plan. So then they would have to once again, determine, a plan with the MCOs, and so we haven't gotten there yet. But there is the potential that they may switch health plans. I would, I don't want to speak presumptively, but I know that many providers do have contracts with different plans, but there is the potential that that member, if it's outside of that 90-day window, that they may have to switch providers. So we're hoping to prevent the churn. It just adds to administrative cost, and we would rather not have or absorb state general funds and federal funding to be spent on administrative costs when that could be actually spent on patient care and optimizing our delivery system. So it would be in the best interest of everyone if that was if that occurred. And so key messages, just share it with your patients, keep their contact information up to date. That's something that you can always remind them, their cell phone, their email, their mailing address, their physical address. and check for their mail. If they haven't received it and they're wondering, they can always reach out, to our Medicaid eligibility, and reach out to my Medicaid and send an email and, request a response for information. So I think that's in a nutshell.
Awesome. Thank you so much. We do have a couple of questions here for you. Wendy Powers asked if the rule change for the highest level of EM that can be billed with preventative, is it still 99212 or has it changed to 99213?
So I wish I had that answer offhand. I'm not sure if it has been changed. Sometimes when we are trying to change things, it may require a rule or a SPA. So I can get back to you and then you can share that with Ms. Powers.
Perfect. I'll write that down. Okay, I think we have one more. Let's check here. And Dr. Aber-McGee, would you be able to share the slides with the attendees today?
Sure, that's fine.
Okay, perfect. So I will create then a PDF and then send them out, as well as a link if you are seeking CE or CME credit for attending today's presentation. After the webinar concludes, please fill out the evaluation form, but I will also send it, because I know some people had to jump off. I'll also send it via email to all the participants here today. So I thank you all so much. Thank you so much, Dr. Aber-McGee, for sharing with us some crucial and very important information regarding the Medicaid Unwind. And I thank you all for participating in this year's Developmental Screening Summer Webinar Series. And I hope you enjoyed it and have a wonderful day. Thank you all so much.
Take care.
Bye-bye.